So, my name is Carol Seahusen, and I am a temporarily licensed mental health counselor and also a nationally certified counselor. And for a diagnosis of major depression, the person has to have persistent feelings of sadness or just an overall loss of interest in things that they typically would enjoy. A big indicator of depression is sleep disturbance. So people who are depressed typically will report that they are not sleeping very well, or and having insomnia, are fatigued all the time, or I guess what is more commonly seen is people report that they are sleeping a lot, that they just don't have any motivation to get out of bed, that they would prefer to stay in bed, sleeping for long periods, that sort of thing. Some other symptoms of clinical depression going along with it, since it is a mood disorder, you can have some anxiety, just general discontent, some guilt, an inability to feel pleasure is a big one. So people with clinical depression oftentimes find that things that they used to enjoy, whether those are hobbies or going out with friends or just enjoying their family in general, that they don't get pleasure in those activities anymore. And they also have a really hard time concentrating. You can notice differences in their weight. They can either gain weight excessively because of their lack of doing anything, if they're just kind of sedentary, or they can have weight loss because they're just not eating and they're not nourishing their bodies. Some other things about depression. Obviously, there's some medications out there that are targeted for depression, or there's several medications out there targeted for depression. Depression is typically a result of a neurotransmitter or chemical imbalance in the brain, which is what causes the mood disorder. It can also impact, the thing about depression that a lot of people don't think of is that it can impact the people that are around that person pretty heavily too, because they're seeing what's happening to this person and they can't help. They can't get them motivated. They can't make them do things. People who are really deep in clinical depression can have a lack of hygiene. They just don't want to shower. They don't want to take care of themselves. Their teeth can decay. And those are pretty extreme, but they can do it. Obviously, counseling, talk therapy, those things are also treatments for clinical depression.